Hi everybody and welcome to another episode with The Anxious Resistance. We are in my home office and possibly our new YouTube background. Thank you so much for joining me. We are going to be talking about Prozac, or otherwise known by its generic name of fluoxetine. Prozac is a very popular antidepressant and was the first SSRI that came out. Some people may even remember back when it came out. And it's a medication that is used to treat major depressive disorder, obsessive compulsive disorder, bulimia nervosa, and panic disorder. It is classified as an SSRI, or selective serotonin reuptake inhibitor, and works by increasing the levels of serotonin in the brain. Now let's talk a little bit about the history of Prozac. Prozac was developed by Eli Lilly and Company and was approved by the United States Food and Drug Administration in 1987 for the treatment of major depressive disorder. It was the first SSRI medication to be approved by the FDA. Okay, so how exactly does Prozac work? Prozac works by selectively inhibiting the reuptake of serotonin in the brain. It blocks those serotonin reuptake transporters and keeps more serotonin in the synaptic cleft. This is thought to improve mood and reduce symptoms of not only depression, but OCD, bulimia nervosa, and panic disorder. Let's talk a little bit about the evidence for use for Prozac. Prozac has been shown to be effective in treating major depressive disorder, OCD, bulimia nervosa, and panic disorder. In clinical trials, Prozac was found to be more effective than placebo in reducing symptoms of these conditions. It has also been used off-label to treat other mental health conditions such as anxiety disorders and post-traumatic stress disorder. Okay, so let's talk a little bit about the side effects or adverse reactions that can happen from Prozac. Like all medications, Prozac can cause side effects. The most common side effects include nausea, headache, insomnia, and sexual dysfunction. These side effects are usually mild and go away on their own. However, if you experience any severe or persistent side effects, you should contact your doctor immediately. Prozac can also increase the risk of suicidal thoughts and behaviors in some people, especially in children, teenagers, and young adults. Again, I talk about some of the suicide increasing effects of antidepressants in another video that I'll link up here in a card for you. Prozac is contraindicated in patients with a hypersensitivity to fluoxetine or any of the components of the medication and should be used with caution in patients with a history of mania or hypomania, seizure disorders, and bleeding disorders. Okay, so let's talk about some of the positives or pros of fluoxetine. Prozac is effective in treating major depressive disorder, OCD, bulimia nervosa, and panic disorder, and has a lower risk of causing sexual side effects compared to other antidepressant medications. It may also be helpful for treating other mental health conditions such as anxiety disorders and PTSD. Treating anxiety disorders with Prozac is something that I can attest to. Prozac does help with my anxiety symptoms and was one of the main reasons that I have stayed on this medication for years, and again I'll talk more about this later in the video. So what are some negatives or cons of Prozac? Prozac can cause side effects and some people may experience withdrawal symptoms if they stop taking the medication abruptly. Something interesting about Prozac is that it actually has a very long half-life, so you don't have to taper off of this one over an extensive You don't have to taper off Prozac through an extensive period of time like you may with other medications. Because of that long half-life, it kind of weans itself off by itself, so to speak, because it takes so long to work out of your system. Additionally, with that, Prozac can take several weeks to start working, and it may take several months before you see the full effects of the dose that you're on. And some of its effectiveness may vary on the person, and also side effects may sometimes and can often outweigh the benefits of the medication. So it is ultimately up to you and your doctor to decide whether this is a medication that is good for you and where the positives outweigh the negatives. Okay, so I want to talk a little bit about my experience with Prozac. Prozac was the first medication I ever took that I had genuine benefits from. This was where the benefits outweighed the negatives. Since I had poor reactions to medications, particularly other SSRIs in the past, we started out on the lowest dose at 10 milligrams of Prozac per day. I was adamant to make sure that I gave all the medications the best try that I could because I felt like I was running out of options. The first 3 to 4 weeks of taking Prozac, I had very painful muscle aches and my joints hurt. I felt like what somebody may feel like, I imagine, with fibromyalgia or other muscle disorders. Over time, these side effects faded. At 10 milligrams, I still wasn't getting any benefit out of Prozac. So my doctor and I decided to raise the dose to 20 milligrams, which is the typical starting dose for Prozac. Again, I had the muscle aches and pains for about another 3 to 4 weeks after the dose increase. Then they began to fade. I noticed a small amount of benefit from Prozac and decided again to raise the dose. I repeated this several times. Each time I had to deal with the muscle aches and pains for 3 to 4 weeks after raising the dose before my body would adjust. Eventually, I got up to 50 milligrams of Prozac daily. So again, this took quite a significant amount of time to raise the dose all the way up to 50 milligrams while letting my body adjust to the muscle aches and pains as I went through it. So I want to say that the whole process probably took 5 or 6 months, maybe even a little bit longer than that. I had the best relief I'd had from any medication at this point, with close to 60% of my symptoms being gone. This is both my depression and my anxiety symptoms. I ended up dropping the dose to 40 milligrams to relieve some of the side effects. I did have some residual muscle aches and pains at 50 milligrams, and this made things like exercise particularly difficult for me and was something that I was really trying to get in the habit of doing. And so I felt like I was getting enough relief from this. I could drop down. I was at a manageable place with 50% of my anxiety gone. Now, that may not be true for everybody to have 50% of their symptoms gone. Some people may experience more benefits, some may less. Again, psychiatric medicine is really, it's an art a lot of the time. It's figuring out what works best for you, what works best for your brain chemistry, what you have the least side effects from. So in conclusion, overall, Prozac is an effective medication for treating major depressive disorder, OCD, bulimia nervosa, and panic disorder. It works by selectively inhibiting the reuptake of serotonin in the brain, leading to increased levels of the neurotransmitter. However, it can cause side effects and may not be suitable for everybody. You may experience some transient side effects like I did. You may reach a dose where you have side effects that don't go away and you may need to drop back down. Again, it's a process. So it is important to talk to your doctor about any concerns or questions you have or any side effects you have as you're taking Prozac. Thank you guys so much for watching this video. If you enjoyed it, please like it, subscribe to our channel for more just like this, and thank you so much for joining me and learning about mental health.